Over the weekend, Tennessee lawmakers restricted authority of schools and local health departments over COVID-19 regulations. Now there's some pushback.
State Capitol Newsroom reporter Gerald Harris is live in downtown Nashville with reaction to some legislation that came late in the night during the weekend. Gerald.
Yeah, lawmakers passed the bill in the dead of the night. Now doctors are speaking out, saying some of the mitigation strategies are needed and does not need to be away with.
A week after sweeping COVID bills targeting mask and vaccine mandates, the state health officer who could be granted broader authority did not want to answer questions about the bills.
Do you think the steps made by the legislature was the appropriate ones?
Most government entities, including public schools, cannot require the COVID-19 vaccination or proof. However, entertainment venues can require negative tests.
We all want freedom from COVID, but, making laws that are anti-mask, anti-vaccine, anti-science, it's a huge step backward for our state.
Dr. Amy Gordon Bono, a Tennessee physician who was at the Capitol as parts of the bills were debated, says the legislation will make responding to COVID more difficult, as masks cannot be required unless 1,000 out of 100,000 residents are COVID positive.
Once your infection rate starts going forward at that high level, it's really hard to stop it. Much like this legislation was a freight train being rammed through, COVID can certainly do the same.
However, private prisons, businesses, and schools can require masks. Dr. William Schaffner, an infectious disease expert at Vanderbilt, says in addition to vaccinations, you can continue to stay protected amid uncertainty.
In crowds, indoors or outdoors, wearing the mask, good hand hygiene, staying away from people who are coughing and sneezing. Those are the sorts of things that will protect you and your family.
The governor's emergency powers could also be limited to 45 days.
Governor Lee, you need to have every available tool in your tool belt to fight COVID. And the legislature has now taken many of those tools away from you.
And Governor Lee said on Twitter that he is evaluating the bills before he either signs or veto the legislation. However, the governor can allow the bills to become a law without his signature past 10 days. Reporting in downtown Nashville, Gerald Harris, News 2.
All right, you can read more about this legislation or COVID-19, the vaccines, and the new guidance online at WKRN.com.